just a few kind of concept review and introduction of our next set of material, and then hand the baton, pass the baton over to Sharon to take it forward from there. And we'll have a couple more case applications as well to really try to sum things up for you before the end of the day. So let's move deeper into the therapeutic process and talk about journeying alongside our clients as they live out their story. So I'll read this slide aloud. When all aspects that have shaped a client's experiences are taken into account, therapy can become a transformative force that can begin to change a frown into a smile, a cry into laughter, self-doubt into self-confidence, personal isolation into social connectedness, mistrust into trust and responsible risk-taking, and even silence and hesitation into articulate words. So that's our goal, right? To journey alongside our clients, empowering our clients after a reproductive loss to live out their story. So we talked about companioning versus treating. The difference there, treating comes from tractare, which means the Latin root tractare, to pull and drag about. Like when you think about that, that doesn't sound very fun, right? Companioning, Latin roots come from com, which means with, and pan for bread. So like sharing a meal with somebody, like, oh, that feels much more gentle, right? And so even that can help us keep that difference in mind. Moving forward, we're going to talk about interdisciplinary work and how we can incorporate referrals to other providers, using outcome measures for clients, and we'll introduce a unified protocol for transdiagnostic treatment, which is like a lot of words, but it makes a lot of sense. Let's see. So even before we jump into this, the interdisciplinary piece, talking about, if we have someone who's coming in for loss, we really want to be asking them, have you seen a medical doctor? What is the diagnosis here? And if that's been a barrier for them in terms of seeking care, we want to really help them get there. It's a little bit of a CYA for ourselves, right? Like, we want you to be assessed for any medical conditions that are contributing to this, but it also can help explain unexplained infertility or loss experiences. It can help address concerns relating to a loss. So it's really, really important that we have our folks seeing their providers. Also, if we're seeing someone in a subsequent pregnancy, we can work with the OB or the midwife to help them understand the impact of the loss, to help them figure out how to coach the person through the loss experience perhaps, or if we know someone has a diagnosis of a stillborn baby or a baby that will be born still, how can we coordinate with medical professionals to support this person and really meeting them where they're at while at the same time supporting them in grieving their loss. We do have research that shows 90% of women do not follow up following a loss, and they don't talk about the risk to future pregnancies, and so that's a really important thing.
90%.
90%.
Yeah.
Right? Like, staggering. And I think, some of the aspects of culture that we talked about, like folks who are in chronic homelessness or don't have access to regular health care, like that may not be something on their radar or in their ability to do that in a way that's helpful. So just helping them make those connections, helping anyone make those connections. Okay. Outcome measures. We want to be thinking about assessing, using the client's language and their presenting concerns, whether it's somatic complaints, like I haven't been able to sleep, I've been dreaming a lot, I've been having nightmares. How can we support them in assessing that on an ongoing basis? How has your sleep been? There are definitely tools out there that you can use, insomnia severity index, or different kinds of tools to assess those specific complaints of our clients. We can also assess based on functioning, how have you been able to get out of the house? Have you been able to meet your goals? So outcome measures help our clients track where they're going. They also help us. We can also revisit that perinatal grief scale every 3 to 4 sessions to kind of track where people's experience is and see, is this grief experience shifting or changing at all? If so, what's different? How can we support you in that, and what's left? We want to pay attention to subjective experience, behavioral experience, and symptom relief, right? So kind of the whole range of things, not just staying focused in one area or another. Again, we want to be working on identifying strengths with our clients, helping them discard labels that they may have applied to themselves, and seeing themselves more fully and whole in their strengths and their ability to move forward through this. To move forward to our unified protocol. So this is a tool that we can use to work collaboratively with our clients as we develop a treatment plan, which is often required, but also really helpful for us to know where we're going and help our clients know where they're going. And so to do this in a collaborative way, we can use this unified protocol approach. So this comes out of research done by Dr. Barlow, who is a psychologist and Professor Emeritus of Psychology and Psychiatry at Boston University. He's known for his research and publications on the etiology, nature, and treatment of anxiety disorders. And this unified protocol approach was developed with a team of researchers at the Center for Anxiety and Related Disorders at Boston University. There are a couple of references here that can be really nice if this resonates with you and you want to learn more. Treatments at Work, Unified Protocol for Transdiagnostic Treatment of Emotional Disorders, the Therapist Guide, and there's also the workbook. Same name, but just workbook, to get more info on this. So why we are introducing the unified protocol here is that it's a transdiagnostic tool. So it's been shown to be effective in working with multiple different diagnoses kind of at the same time by focusing on these core areas. You can really integrate your therapeutic modalities into this. And we know that grief experiences are often comorbid with the other emotional experiences of other diagnoses. And so this kind of multi or transdiagnostic approach can address and has been shown to reduce the clinical significance of symptomology for clients, even more so than like a single protocol for CBT for depression or anxiety kind of things. So it's evidence-based and it does help kind of with a range of transdiagnostic issues. So it can be really useful to incorporate for clients who've experienced reproductive loss, and we're incorporating that grief work into our treatment plan. And so the 5 core skills: mindful emotion awareness, cognitive flexibility, countering emotional behaviors, understanding and confronting physical sensations, and emotion exposure. So I'm going to hand it over to Sharon to take us away to get a more visual representation of this and look at applying this.
How many of you are familiar with the unified protocol? None of you have heard it before? Okay. Okay. All right. So let's walk through what this is. As you can take a look, it looks like an arrow, right? Kind of, sort of, pointing out. But what I really want you to see is that it's a house. You see a house? Okay. Relief. You see a house. Okay, so we have adapted this image from Dr. Barlow's work, but we're keeping the foundational work that he has done. So at the core of this house, we have the setting goals and its reasons for why we're setting those goals. And just like grief is not linear, neither is this with the unified protocol. So at any point, your clients can be, whether it's the second level, understanding the emotion, they can go all the way up to the top level of expression to the emotion. In terms of the techniques that you're using and how you've brought in your conceptualization of your client, you're using these interventions at any level in and out of these floors. So your clients can even take a look at this visual to see where they're falling in that progression of their treatment, okay, and of your companion with them, to feel a sense of empowerment and validation. Psychodictation can be a powerful intervention with those that we're working that have experienced their reproductive loss. But again, it's not a linear process. We're going to move in and out of those rooms. But at the core of that room is the foundation of developing that relationship with your client. Why do you think that is? I know that we've been very heavy on it, so why do you think that is?
Well, relationship is regulating. So if somebody is very deeply in a dysregulated place because of trauma or grief, just being in contact with another nervous system is really important for helping be able to settle, to do whatever the work is.
Absolutely, absolutely. Right? We are creatures that connect. It's part of our humanity. We seek social relationships in some extent or the other. Sometimes we seek them in a dysfunctional way, right? But we're still seeking them. And in therapy, if we don't master providing that foundational relationship with their clients, the outcomes are not going to be manifested. Okay? So ruptures can happen more easily. Clients may leave sooner than the terminated goal mark because that foundation is not there. So it's important that we understand how to lay that foundation and how to set the goals in terms of helping our clients work through that grief. And we do utilize Worden's test of grieving as part of the goals that we recommend our clients to work through. It's not exclusive because there's other things that can come into play. But we certainly want to incorporate that interpersonal psychotherapy, that interpersonal relational theory in order to set the goals as they become meaningful to our clients. So introducing that reproductive story is a key factor. Okay, and you've learned how to do that, how to incorporate that with your clients. If they don't have the motivation to set the goals with you, it's harder, right? You're dealing with more resistance with your clients. So it's important to help identify what is it that motivates them to achieve their goals and what would those goals look like, right? As we're building that therapeutic alliance, we are constantly validating the individual, their thoughts, their feelings as they come, because we are giving them that safe space. We're doing that active listening like you saw with the role play, right? And we are coming from that place of a cultural humility to always show curiosity for where they're at and how they're doing, right? So we want to always have an awareness and appreciation for how we appreciate our clients at this foundation level, as well as appreciating ourselves, right? Constantly doing that self-assessment of what am I bringing to this therapeutic relationship, right? What, if any, parallel processes am I noticing in the way that I'm relating, in the way that I see my client relating to me? Why is it that we're even doing this counseling, right? This grief therapy. So all this is what you're going to see in this foundation layer so that we can help our clients work through these tasks. Does that make sense? Okay. And we're going to do so by talking about a new friend, Eric. Eric is 28. He is an Asian American male of Japanese descent. He presents with the following symptoms: inability to sleep, racing thoughts, loss of motivation on his job. He's mentioned that him and his wife are having marital problems as a result of several miscarriages and possible infertility. He's reported both of their families were aware of the losses, but often have made comments such as, "You both are still young, wait a few years and try again." His wife, Phyllis, recently disclosed to him that she had an abortion at 18 years and was concerned that this was impacting her ability to carry to term. She told him she has not disclosed this to anyone else and is struggling with some depression. Eric has admitted he feels at a loss for what to do, alone, and unable to talk to anyone about his concerns. He also admits his drinking has increased. Additionally, he reports spending extra time fixing the cars and tending to the yard work to feel productive and listening to several podcasts. Eric notes that no one, not even his wife, knows he is attending counseling. So I'm going to walk you through the unified protocol using this case scenario, okay? So now at this entrance level, we are talking to Eric about what are his thoughts, right? And we are going to, did I miss a slide? Oh, I'm jumping to myself. I'm ahead of myself, sorry. I'm getting excited about this unified protocol. Listening to this story, this case scenario, what, if any, aspects of the culture of humility can you incorporate here? What is it that you're noticing that you want to be attuned to in terms of cultural humility?
Asian American,
Mm-hmm.
the expectations around the Asian culture of, well, they're married, so not the sex before marriage part, but the family's ideas of just wait,
Mm-hmm.
and try again later, that expectation that you're gonna have children, like, continuing on.
So maybe a subtle microaggression there. Oh, you're young, you can wait. Maybe, perhaps, right? Maybe they perceive it as such from their family members. Maybe. Okay. Okay.
We don't know what his wife, if she comes from a different cultural background, and the impact on that in the relationship.
Mm-hmm.
Although I think it does say that both of their families are making those comments.
Yes,
Yeah.
but that would be different if she was Caucasian and her family was saying that versus his family.
Excellent point.
So that could impact how he feels about it.
How are you conceptualizing Eric? What kind of psychosocial questions are important for you to help understand what's happening? You can cheat by looking at your psychosocial assessment section. What are you going to be asking him? You know, there's a relationship here, that of him as his wife. He's coming to counseling without her knowledge. I wonder why. Right? There's a sense of secrecy there.
I'm questioning shame. One, because of the fact that the wife, right,
Mhm.
girlfriend, wife never disclosed the abortion. So how that impacts him in terms of, does he have shame about abortion?
Mhm.
And then just the shame of not talking. Yeah, and it's not saying that he's been on a counseling.
Well, he's unable to talk to anyone, so he feels some inhibition about sharing vulnerability.
And what is he doing to cope, since he's not talking to anyone? How is he coping? He's drinking. What else is he doing?
Fixing.
Fixing stuff.
So if he's grieving, right? If he's grieving, what can we interpret? What kind of griever is he? The intuitive or the instrumental? Right? So this is part of what we're inquiring. How is he coping? How is he grieving if he is tapping into understanding that there's a grief here, right? That there's a loss here, okay? So what goal would you work with him first? What would be a possible goal if we're thinking about maybe a task from Worden? Or should we look into maybe psychoeducation?
Probably a good start, because it sounds like he's not very well versed in understanding that it's normal and okay
Right.
to have these emotions.
Right, so he's coming to us with something that is not working well here, right? I'm being stirred by something, but I don't know how to name it. I don't know what it is, right? So maybe we can provide some of that language to see how is he understanding that, right? So maybe the goals could be just, let me help you understand what grief looks like. If this is something that you will relate to or not, let's work through this together, right? Would you provide any referrals for him? Is there any collaborative work that you can do with other entities based on what he's presenting?
I guess you can assess duration and severity of the symptoms to see if medication would be necessary at this point in history.
So assessing for that intensity would be important, right, and the occurrence, excellent. Is the drinking a concern at this point?
Depends what increased means. He maybe didn't drink at all and now he's drinking a little
Right.
bit, or maybe he's drinking a ton every day, so. you
Right,
can
so we
assess.
don't know if he's passing out from it, we don't know if there's a history of alcoholism in his family, right? Okay, so part of the things that we need to incorporate in our assessment and conceptualization, okay? And anything that you will intervene right away with him?
I also want to know if he's seeing a doctor about the miscarriages and possible infertility. What does that look like for them, and is he feeling comfortable with his providers and that kind of piece too?
Right, because we don't know much about the medical history necessarily, right? If the miscarriage is her difficulties holding on to the baby, is it related to some genetical factors, right, that maybe he's contributing to? We don't necessarily know, right? So part of that medical history would be part of that psychosocial assessment that you, okay, so awesome, we're on the right track.
Would it be helpful to make sure he's maybe seeing a doctor about sleep issues, just to rule out if there's anything medical?
Yep. Absolutely, absolutely, absolutely. So with Eric, we're going to help him understand the emotions, okay? We're going to help engage in that thought. What are the thoughts, the physical sensations, the behaviors that have resulted from the reproductive loss? And so this is the entrance level of the house where we're meeting him at. So I would ask him, what are your thoughts that you have around your loss? You've had three miscarriages? Or two? Three, thank you, I need that story in front of me. Three miscarriages. How have you reacted to those miscarriages? Right? Your family is saying certain comments to you. How is that impacting your relationship with others? Is he showing to you that there's anxiety? Is he showing to you that there's anger? Again, these would all be expected, right? Does he even know that it's okay to feel those? Right? And coming from a male perspective, it might be even harder for him to tap into the fact that he's having these feelings. So I'm wondering, Eric.
Or being a Japanese.
Right.
Doesn't.
Exactly. So I'm wondering if within your culture, if there's a sense of openness in talking about loss, or what are the norms that your family has experienced when there's been a loss in your family, right? Absolutely, absolutely. So tell me, Eric, about any physical sensations that you've been having. What have you noticed? Do you notice restlessness? Do you notice a heavy heartbeat? Are you showing difficulty breathing? Are you getting more headaches or any headaches, whereas before you weren't getting? Can they be related to the loss? Right? What do you tell yourself when you find yourself stressed? What is that self-talk looking like? Right? Is the alcohol preventing you from thinking?